Hey everyone, Dr. H here with 𝑰𝒏𝒕𝒂𝒍. I'm here to talk to you about a condition that we see a lot in our athletes, especially runners and wrestlers, MMA, UFC fighters. That is called the Piriformis syndrome. Okay, what is Piriformis syndrome? Now, when the sciatic nerve comes out from our lumbar and the sacrum here, it makes that big thick nerve right here. It's the largest nerve that we have in our body, and that is called the sciatic nerve. Now, when the sciatic nerve comes out of here, in about 80 to 85% of people, it actually comes out from below this piriformis muscle. Now, the piriformis muscle here, as you can see, it is connected from the femur head and it's connected to the SI joint. It has got three bellies right there. All three bellies here are the piriformis muscle. Now, again, 80 to 85% of patients will have piriformis will go under, the sciatic nerve will go under the piriformis. 15% of patients will have the sciatic nerve actually pierces through the piriformis muscle, which pierces through it. Now, when there's tightness, some trigger points right on the piriformis muscle, then that will elicit a lot that sciatica and the low back pain, that shooting pain down the leg. Now, what I'm saying here, we see a lot of athletes. It's because they're always active. That muscle, especially that group of muscle, is always working. It's always overworked. So we'll have a lot of tenderness in that area, a lot of trigger points in that area. When there's trigger points, it's going to put pressure on that sciatic nerve. Now, here's a test that's called FAIR test, F-A-I-R, which stands for flexion, abduction, and internal rotation, okay? Or it's also called the Piriformis syndrome test, okay? For this test here, I'm going to have the patient lay on your right side here, please. Okay, perfect. And we're going to start for this test. We're going to, so the piriformis muscle actually sits right here, right at the femur head. The three bellies are right there. Okay. Now we're going to start with flexion. Okay. Adduction. We're going to fixate or put pressure right on the pelvis to keep it in place. And I'm going to push this knee down. Now, if this causes any pain in the buttocks area, hamstring, or even down lower, that is a positive for Piriformis syndrome. And that is why those patients needs to be in here, needs to get adjusted to relieve some of that pressure off the sciatic nerve.